And we're going to switch the conversation over to Fatal Attraction. So, where do you want to start?
Alex.
So, Alex Forrest, what did you see?
I feel like once you get to the point in the movie where she has like the self-injurious behavior after he says that he can't be with her, when you retroactively look back from that point, you then start to notice things previously that fit into that borderline personality disorder, where like at first you think it's a movie about just someone who like is having an affair with another man, but then you look back and you're like, oh, these are like impulsive decisions, unstable relationships. And so I thought it was interesting to look back at the beginning after getting to the point where you're like, okay, there's a personality disorder here.
And I really like that logistic, because not to have that logistic and to feel that way when you first meet Alex, while it would have been diagnostically and clinically accurate, also serves to pathologize and stigmatize. Mm-hmm. So this is type 2 error. This is you believing that there's nothing there and then realize there is. Mm-hmm. And that's perfectly fine as long as you remain flexible in your critical thinking. And once that scene did occur, and once you observe that behavior, you were able to go back and formulate what's going on, resulting in a pathology. So I do like that logistic. The only problem with it, potential problem, is that if her behavior was severe enough, what you may have missed could have been or could have resulted in a patient death. Mm-hmm. So you always got to keep patient safety first and foremost on your mind. But then right after that, unconditional positive regard, starting with a square one that this is normal behavior until it's proven otherwise. And that scene in her apartment begins to prove otherwise. What do you think of, again, and I really love this logistics. So we're at that scene in that apartment, and now we're going to retroactively look back to the scene in Central Park when his wife is away and they're tossing around a tennis ball with his dog Quincy. What do you think of that scene?
She's like euphoric almost, like she's at like a high, I feel like.
And she switches very, very quickly when he is he like plays the joke on her about being ill. And then she switches back again very quickly after saying that her dad died, which actually happened, but then she lied about it. And so there's like a lot of lability in like a period of like 5 minutes.
Yeah.
Yeah.
Yeah. And, I think at a conscious level, this looks normal. I mean, that is a crappy practical joke to play on someone. And I think her reaction would be even milder than what I may have done. But subconsciously, it made me uncomfortable, aka anxiety, that there was something not right. Mm-hmm. My id was trying to express something, and it was a bad thought about her, but my superego would not allow it. Anxiety. Because that friction between one and the other, it's anxiety. So there was, say, subthreshold or subclinical anxiety, because consciously, I had no problem with that scene, but subconsciously, I was struggling with it.
Especially because she responded to a bad joke with what appeared to be another really bad joke about her dad dying.
Which, again, I get.
Yeah.
Yeah, I get. That you fend off inappropriateness with something just as inappropriate.
And like you even notice, I forget his name.
Dan?
Dan, yeah. I didn't like his character very much, so. You even notice him be like, oh, that was weird when she says that joke. I think that's like the first time that he notices that something might be a little off about her.
Yep.
As well.
And of course, we do find out that there's something much larger that is wrong, because exactly 37 minutes later, the punchline of that joke turns out to be true. So she apparently impulsively reacts the way she does. Mood lability appears overly apologetic. Again, labile mood, labile affect. And then we discover, no, she actually was telling the truth the first time. And that is upon the discovery of that scrapbook, which is exactly 37 minutes later. And what's remarkable about this movie is that within those 37 minutes, and again, these two scenes are really connected. Within these two scenes, she actually demonstrates every single diagnostic criteria of borderline personality. All of them. Okay? Not just the required 5, but all of them. All right, so borderline personality disorder. And if you remind me, I have a document that actually timestamps every scene along those 37 minutes, filling in the diagnostic criteria of the DSM. So it's basically taking the page out of the DSM and reorganizing it along a chronology that fits the script of Fatal Attraction. So if you remind me, I could send it to either you or Kathy, and she could disseminate it. What else?
I mean, she progressively she keeps on like topping herself as the movie goes on, doing more and more inappropriate things, until the final scene where.
Why does she do that? Why is she doing what you just observed?
She's not getting the response that she wants.
That's clear. Yeah. So what?
I think she obviously has a very like unstable self-image, and because there's a situation is not like giving her the outside validation to like stabilize her image, she keeps like escalating because she's not able to give herself the things that she needs emotionally, and so it just keeps getting worse and worse and worse.
Yep. That's exactly right. What you're talking about here is her having an external locus of control, which is characteristic of several cluster B personality, perhaps all cluster B personality disorders, hence why they cluster. And even though when we hear external locus and that need to be liked, we think of histrionic, they cluster. It's borderline too, and it's exactly what's happening here. Dan, what comes out of his mouth becomes how she feels about herself. She internalizes that because she does not have her own internal locus. If someone had an internal locus, and if they understood no matter what Dan or quite frankly anyone else says about me, says to me, or thinks about me, I'm still the same exact person, that is an internal locus. None of this happens. Well, I shouldn't say none of it, but what we see as a result is likely not going to happen. So internal versus external locus of control. This is social learning theory. Now, why does she have an external locus? Like, where does this and social learning theory kind of evolve from? Because the answer gets at your initial observation of how she keeps on escalating.
Something in her childhood?
Yeah. What happened in her childhood?
Well, her father died.
Give me more. And if you don't know, as a clinician, what are you going to ask her?
Abuse or trauma? I'd ask
Yeah.
about that.
Oh, and what do we know about this? Anybody do a deep dive?
About her specifically? Oh.
Yeah. She's a victim of incest.
Really?
Yeah.
Oh.
Mm-hmm. And there's tons of interviews with Glenn Close, the actress who portrayed Alex, saying that the script calls for her to be a victim of sexual trauma. Do you think she killed her father?
It's possible.
She says she discovered the body. Even if she didn't kill him, and again, that's in the blogosphere. I don't think, unlike the, God bless you, unlike the sexual trauma, the idea of her killing her father is not straightforward. Right? It's suggested, but that's it. Even if she doesn't, and she, quote unquote, only discovers the body, you could imagine the ambivalence. Because she just discovered her rapist dead. And simultaneously, her dad. And that conjures up incredibly mixed feelings. That's called ambivalence. And if not processed, and perhaps processed in therapy, that can be problematic. Her father abandoned her. It is very unlikely that she had come to grips of what was happening between her and her dad prior to her father's death. And there's probably a lot of regret in finding that body. And there's probably a lot of things she wished she could have told him, and a lot of things she could have helped rectify. Remember, at this age, whatever's happening to her, she believes is her fault, right? That's the normal, age-appropriate egocentrism of a child, right? So now you really get to understand what's making this person think the way she is. Every sexual relationship, every intimate relationship she has with a man afterwards is nothing more than a replay. And here is this guy, Dan, who's ready to abandon her again. That's why she escalates. Because she's decided men are not going to use me like this anymore. This is a traumatic reenactment of her original relationship with her dad. And that all kind of comes to a head for us. Discovery. When Dan breaks into her apartment and we see that book, we see that he actually did die, and we realize, oh. Okay. That's 37 minutes after he pops up and says, boo. So, dialectical behavioral therapy is a form of CBT, albeit having both individual and group components that has empirical evidence to improve outcomes for people with borderline personality. That does appear on exams, and it appears frequently. So, again, that's DBT. Dialectical behavioral therapy will be your single best answer as to which psychotherapeutic modality is or could be helpful in individuals or for individuals with borderline. What else?
I feel like she moves beyond borderline towards the end, because she moves, for me it was towards like more delusional, because I don't remember her exact words, but in the bathroom when she finds I can't remember her name. The wife.
Yeah.
She's like, yeah, she finds her and she starts yelling about like he was supposed to be with. I don't remember exactly what she says, but basically, she's delusional, saying that he was going to be with her, and then I think she thinks that if she kills the wife, that Dan will be with her, and that I don't think you can explain just by borderline. I mean, maybe you can, but I feel like at that point she's gone too far, and she's becoming delusional.
So, I want to take two kind of paths toward delusional here. First, I want to take the clinical path. What you're explaining to me, what you're just describing, is referred to as stress-induced psychosis. Okay? Not all that is psychotic is schizophrenia. Individuals can become psychotic even without a diagnosis of a psychotic disorder. For example, nobody in here is mentally ill. Matter of fact, the competence in this room is at the level, literally, of a medical student. Everybody here right now is awake, they're alert, and they're operating and functioning just fine. Despite that, I can make any one of you psychotic if I wanted to. You just have to give me enough time. No doubt. All right. Stress-induced psychosis. Now, there are variables, there's factors in terms of risk, aka risk factors, that predispose. And I'm going to set everybody's predisposition right now on a scale of 1 to 10, 10 being the very worst, at a 1. That just means I have to dial up a level of stress equal or comparable to a 9. I will get you to that 10. I just have to come up with a 9. Now, if somebody entered the room with a moderate mental disorder, or a mental disorder of moderate severity, let's say major depressive disorder, moderate, right? Because there's mild, moderate, severe. They sat down, I will or could do the same exact thing. However, the level of stress I would need to induce now is more along the lines of a 5, right? And of course, if somebody came in who has schizophrenia, the level of stress could be 1. And a great example of that is all you need to do perhaps sometimes is simply sit down at a desk with them. Wrong. Because if you actually square yourself, the nonverbal communication could be enough to set them off, right? Because this is confrontative. So we always make sure we triangle our chairs for that very reason, right? Because a stress at the level of a 1 can be enough for some individuals. Stress-induced psychosis. That's exactly what we're seeing here. That's the clinical. The psychological deals with regression. So I think there's a good chance that she's regressed here. And this may be her regressing to a time where she became fixated at or around the age of 5. What psychosexual Freudian stage would she perhaps be at the age of 5? I'll give you a hint. It's not
Phallic?
exactly right. And what conflict is resolved at the phallic stage of psychosexual development? It's called the Oedipus complex. At the phallic stage, the child for the first time realizes that there is a parent that they're like, and there's a parent that they are not like. Right? And for someone like Alex, that hit her over the head like a sledgehammer because not me was sneaking into my room at night. Yet, thoughts of a child at that age, per Sigmund Freud, are that they want to possess dad and kill mom. Right. So when we see this play out with Beth at the end of the movie, if I kill Beth, I will have him. It's a replay of the Electra complex for her. She's killing the displaced mother object called Beth so she could possess the displaced father object named Dan. Right. And hence she comes off to us looking psychotic.
So my question then about that is when she's with their child and she has this like she's doing things with the child that are very childlike, like taking her to an amusement park and like showing her like care and affection. Is that her taking on like the caretaker role in the sense that that's what she didn't have and she's like, or is that more like she's just so obsessed with Dan that she's taking over the role of the mom?
It's a great question. Yeah, and I don't have an answer, but I would love to ask her that. Right, because first and foremost, again, I would think that this is just quote unquote normal behavior. It's not normal. It's illegal, but maybe not pathological.
Yeah.
In that she's abducting a child. The larger question is, okay, well, why did you take her to an amusement park? Right. So I get the abduction part of it, and I don't want to pathologize that because I always stress to my students that we always start at square one. So while I will certainly tip my hat on the illegal nature of it, we're going to say that it's otherwise normal, right? Until it's proven not to be. But the first question that then comes to mind is, why an amusement park? And in answering that question, does the idea of abnormality begin to seep in? So again, is this a regression? And maybe she has some experience at an amusement park? Maybe it's a thrill. I mean, amusement parks are something that I believe it was Harry Stack Sullivan talked about, social learning theory, in terms of people seeking out fearful events and circumstances like roller coasters, like haunted houses. Or might it be something else? But I didn't see anything in the movie that would point us in any real direction here, but I would love to ask her that. What's going on there? Because if she's going to regress moments later, I think it's reasonable to at least consider that she's regressing already. Mm-hmm. And maybe that is a driving force as to why she ends up at an amusement park.
I think also the follow-up to that, because I believe it's after, I may be misremembering, but I believe it's after that she kills the rabbit. Or does she kill the rabbit before she takes her to the amusement park? I don't remember.
I think it's before.
I think it's before, but they don't discover it. And yeah.
Okay, so never mind.
What about the rabbit? I mean, that might be the most memorable, infamous scene of the 80s. I mean, it even made the Family Guy, which you know you've withstood the test of time if you've made the Family Guy. There is a loose reference to this earlier in the movie, and it again gets to a point that you made in that Dan is turning away and she is continuing to escalate things because there's a scene where she's trying to reconcile with him. I want to say that it's in a parking garage. And he is turning away once again, and she blurts out, "I'm pregnant." Now, do you believe her? Nobody believes her then, right? And that would be consistent clinically. I mean, an individual with borderline, maybe manipulative. And just the way and when she blurts it out suggests that this is a desperate attempt for him to do an about face and engage her. And he does. Right? He calls someone who apparently is her physician, who then confirms the pregnancy test. Right? What about that? Now, do you believe her? Why or why not?
Part of me believes that she could be pregnant and that she had purposely gotten pregnant, like, in order to have this over him. Like, that actually does make sense, that, like, she did this on purpose, and maybe she had told him that she was using birth control or something and, like, was lying because then she could get pregnant so that he would have to stay with her, or at least she would try to make him stay with her.
I think that's just going off of that. I think she specifically mentioned she thought she couldn't have children.
That's true too. Yeah, she just mentioned that she's. By the way, small tangent. Anything about that?
Thinking that she can't have children?
Yeah. My gut says is that she misinterpreted what her doctor told her.
That she shouldn't have children?
Well, no, I don't think a doctor should say that. I think the physician commented that it's going to be difficult for you to conceive. It's going to be really hard for you to have children. So I think her maybe, again, borderline catastrophizing, I can't have children. What might be going on that would be clinically accurate, that would be evidence-based, to suggest why a physician would have told her that? And I think there's two answers here.
Isn't she in her late 30s?
Well, I don't know when the doctor told her, though.
If she's had to have an abortion in the past?
That's possible. It's possible. There's still 2 more. Mm-hmm.
I was thinking psychiatric medication use, like if they cause.
That's one. Maybe she was placed on a medication in which there would be concern of teratogenicity, so you can't become pregnant on this. Again, poor choice of wording, and you could see how a patient may misinterpret that. That's one. What's the other one? How about maybe she's in her early 30s, maybe in late 20s, but her LNP is 24 years of age. What's that clinical scenario called?
Premature ovarian.
No.
And ovulation.
You guys are both. I mean, you're not. Both of you are right. From a psychiatrist's perspective, what's that called?
Amenorrhea?
More specific. Primary or secondary?
Secondary.
Yeah. Secondary amenorrhea. So what's a potential cause of secondary amenorrhea in somebody, especially with borderline personality disorder?
Eating disorder?
Yeah. And we have a common variable, right? Incest. Early childhood sexual trauma confers risk for each. So I wonder if that little line, my doctor once told me I couldn't get pregnant, or whatever, I think speaks volumes. I think we could discuss anorexia nervosa here. And she does binge, too, in this movie. Remember in the scene where she's calling Dan frantically? Did you notice what's in that room? all over the bed. She's binging. I mean, there are wrappers everywhere. A potato chip bag. Again, normal behavior for some of us. But in the context of what we're talking about, especially someone with established borderline personality and potentially secondary amenorrhea, we have to consider purging behavior. And if that's the case, this may be either anorexia, which can have a binge eating purging subtype, or even bulimia nervosa. Yeah. All right, so what else do we have for Alex? Is there another scenario you could work through about her not being pregnant and lying versus being pregnant? And
She seems to really want the child if she's actually pregnant, but she does a lot of like risky things. Like she smokes a lot and like all these other things that may not to say that people who are actually pregnant don't do those things, but for someone who seems to like be very serious about wanting this child and like wanting that kind of life, she seems to be doing a lot of other things that would make it seem like she's putting that child's life at risk.
yeah. And I think maybe a large part of that is that the reason why she wants to be pregnant is because she believes that's the way she's going to keep Dan.
Yeah.
She's actually surprised when Dan says, "I'll be with you every step of the way. We'll get an abortion."
Yeah.
I mean, that's how wonderfully supportive he is, right? Yeah. I'm not going to even get to that character, and I think I agree with you. When we have these conversations, while people do bring up next character to discuss is Dan, I feel very uncomfortable discussing mental illness in the context of Dan because this is normal behavior.
Yeah.
And I don't want to pathologize, almost give him an excuse as to what he does. Now, there might be a mental illness there, but it's terribly uncomfortable because it feels like you're making excuses for him. So, again, spoiler alert, we're not going to get to Dan. We have about 5 minutes left in our discussion on Fatal Attraction. The other thing I want to just briefly discuss, and this, again, is very scene, is that she may have set her doctor up to tell Dan what she did. Now, what doctor would do that? I mean, none of us. Nobody at Robert Wood Johnson Medical School. Could you work this through a little bit?
I mean, this is like terribly unethical, but I wonder if it was like a psychiatrist or psychologist who like threatened to hurt herself or kill herself, like unless you do this.
Could be. Mm-hmm.
A friend.
Could be a friend. Could be that. Anything else?
Was she with him when the doctor called him?
No.
Or when he?
I don't think so.
Maybe it was her.
I think it was his lawyer friend.
Yeah.
It was with
Yeah,
Dan.
maybe it was her using a different voice. I don't know. Who knows?
Yeah, we don't see him, do we? Or do we?
The doctor?
Yeah. I don't recall.
I don't remember.
No.
Yeah. I want somebody to take a deeper dive with the idea of being unethical. First of all, what kind of doctor? Again, I know it's the 80s, but there were things like HIPAA back then too. So this guy, this person is just indiscriminately, sure, yeah, no, she's pregnant. So
Like a different name or like use someone else's identity who was pregnant.
Oh, she could have. She could manipulate the doctor. Yeah. She could also have slept with him. Right? I mean, again, not all physicians who violate HIPAA sleep with their patients. Right? But this is Hollywood, and that's something to consider here. By the way, we know that she would have no problem with it, right? Because after this discussion and then really seeing how the plot of this movie plays out, when we go way back to that Saturday morning meeting that the lawyers are meeting in like an emergency session, what's being discussed then, and what is your interpretation of that today?
That she believes the woman when she was talking about how it could have been anyone that she had slept with because she had slept with multiple people.
Who slept with multiple people?
The woman who wrote the story.
Who's the woman who wrote the story?
Alex?
Huh?
Alex?
What?
They turn to her and say, well, how reliable is
I
your...
totally missed that.
Right? She has no problem. She's very reliable. It's her.
Oh,
So-
so they didn't explicitly say she
No,
was
no, no, no,
Sorry,
no.
okay. I was like, how did I
No,
miss
but-
that?
And they didn't explicitly say that that she slept with their physician too, and this guy's on the hook to then lie on her behalf. Otherwise, he might get reported to the medical board. But there's repetitive behavior, specifically promiscuity here. And that is the reason why they convene. Now, again, there's a backstory to this. I'd have to read it more closely. I have not gotten to it in several years. But I would not be surprised if it is explicit in the backstory that she was the one that slept with the senator. Right? But I think that's, at the very least, highly alluded to. One other thing I want to say about all of this, again, we're still sticking with the same scene. Way back when, and not the 80s, but certainly the late 60s, if not early 70s, there was something called the rabbit test as it relates to pregnancy. Anybody have an idea what that is? So there's two versions of this, one that is medically based, the other one that is not. The one that is medically based is that 60s, to find out you were pregnant, you had your blood drawn. And that blood was injected into a rabbit. The rabbit was then euthanized, and their ovaries were then mounted. And if they found elevated levels of beta-HCG, you got a call congratulating you that you were pregnant. People outside of the medical field heard about this, and it kind of became an urban legend that if a woman went to their doctor and had the blood drawn and it was injected into the rabbit and it died, you were pregnant. If it stayed alive, you were not. Not true, it's not the way it worked, but that's what many people believe to be the rabbit test. There was even a movie made named Rabbit Test, starring Dustin Hoffman, where along the urban myth part of this, his character goes in for a routine physical, gets routine blood work, has the blood work mixed up in the lab, gets a phone call saying, congratulations, the rabbit died, you're pregnant. Right? And then and it's a comedy. And Dustin Hoffman then has to somehow figure out how this possibly could have happened. Right? So the scene where she blurts out she's pregnant and the scene of the dead rabbit do connect. And it may be this writer-producer's, Durden's, artistic way of expressing to us that she in fact is pregnant because the rabbit died. Right. So, although I think clinically, I would suspect that she's lying. All right. Well, we'll leave it there. It's 12:30. We'll leave it there. We'll say goodbye to everybody on the other side. We'll come back. We will post on Twitter when we will start our clinical case conference over Zoom. Thank you.